Thank you. Well, it is 2:30, so we can start on time. Well, first of all, thank you everyone for joining, and welcome to Health and Climate Change, Common Challenges, Common Solutions. This is a webinar organized by the Council of Europe Development Bank, or CEB, in collaboration with Decide Health Decision Hub. I'm Jelica Vesic, I'm Communication Officer at the CEB, and I will moderate this event today. This is the first in a series of events that we are planning to organize throughout this year under a very broad umbrella of inclusive, sustainable and resilient recovery from COVID-19. This event will last approximately 90 minutes, and in the later half, you will have an opportunity to put your questions to our panel. So if you have questions or comments, please use the chat box. Throughout the duration of the event, if you could keep your mic muted, that would be great. Now, on the topic of today, as unfortunately we're all very much aware of, Europe is in the grip of a huge health crisis, coupled with intensifying challenges brought about by climate change. There is a consensus that the current COVID-19 pandemic is a direct result of human encroachment on natural habitats of other species. And with the climate change, it looks very likely that these kind of occurrences are going to happen more and more. And at the same time, COVID-19 did not strike in a vacuum. In Europe, we have seen several decades of underinvestment in health, coupled with the growing incidence of non-communicable diseases, aging population, and in general, an increase in inequalities and including health inequities. So the objective of our discussion today is to look into strategies, whether through policy action or investment, for creating a healthy and sustainable Europe post-COVID. For that, I am actually very, very pleased to welcome 4 speakers to our discussions, namely Caroline Costongs from EuroHealthNet, Stephanie Matisse from European Network Architecture for Health, Pascal Garel from European Hospital and Healthcare Federation with the wonderful acronym HOPE, and Thomas Bignal from EASPD, European Association of Service Providers for Persons with Disabilities. Before we dive into the challenges and hopefully solutions to the health and climate change conundrum, I would like to invite my colleague, Monica Scatasta, who is Director of Technical Assessment and Monitoring at the CEB, to give us a few introductory remarks and to tell us, well, first of all, why health is such a central topic for us here at the CEB, and also why this webinar is particularly timely with regard to certain reflections on European health systems which are currently ongoing. So without any further spoilers, I'll give the floor to Monica.
Thank you, Jelica. I hope you can hear me properly. Good. I see some nodding. As you said, Jelica, indeed, this is clearly a crucial time for health systems in Europe and worldwide. Health system is still at the forefront of the battle against the COVID-19 pandemic, but they're also a central element now in Europe's developing long-term response to recover from the crisis and also building a new and more resilient future, we hope. The ongoing crisis has clearly indicated that resilient and inclusive health systems are a pillar of our societies and also of our economies. There are clearly economic impacts as well of vulnerable health system. The ability of health system to withstand a global pandemic and also future both local and global shocks may impact not only in everybody's life, but also in every aspect of our economic activities, from a local restaurant to global supply chains. So understanding the nexus between the resilience and inclusiveness of health systems and the challenges posed by climate change and environmental degradation is clearly, in our view, an important element in this reflection. It is not the only element, of course, and indeed, even before COVID-19 hit all of us, healthcare needs in Europe had been growing due to population that is aging, the increasing incidence of non-communicable diseases, health impacts of environmental degradation. I'll touch on that a little bit later. Now at CEB, clearly, as the Social Bank for Europe, we have been supporting health-related investment in health-related infrastructure, building, renovating, modernizing health-related infrastructure from hospital to neighborhood healthcare centers. And since 1997, we have also been investing in social care, in the social care sector, and this is a really important part of what we do, of our DNA, I would say. And when COVID hit, indeed, yeah, the CEB was among the first and the fastest multilateral development banks to respond. In fact, last year, about half, a little over half even, of our approval of our approved loans were dedicated to COVID response, mostly to support healthcare response capacity by financing our member states' extraordinary expenditure. Now, the CEB is also mobilizing private finance for health investment. Again, last year, two new COVID-19 response social inclusion bonds we had two issuances, and the inclusion of health sector investment in terms of the use of proceeds of the bank's social inclusion bonds, an area in which the CEB was a pioneer, and we've seen now the explosion of interest in the market for this type of instruments. So, you know, why is also today's discussion especially important for us at this very moment is that we're also finalizing a report that will explore how we as international financiers can contribute to the resilience of Europe's healthcare systems in a way that is socially inclusive, territorially sensitive, environmentally sustainable. And the focus areas are diverse, from primary healthcare, long-term care, smarter, greener hospitals, and indeed today's seminar with the focus on how indeed the climate change affects health and our healthcare system, and how the systems can respond to these challenges and also better align with the goals of the Paris Agreement while achieving global health goals. I think this is a crucial element that will feed into our reflection. You have already touched upon, Yelica, some of the key elements and how crucial the interaction between human health and well-being and environmental health in the One Health concept, how closely interrelated they are. And indeed, WHO already in 2006 had estimated that about a quarter of global disease burdens and more than a third of the burden with regards to children and children's health was attributable to modifiable environmental factors from air pollution, particularly as regards fine particulate matters, to contaminated waters and other aspects. And indeed, we know how climate change is really not helping in this respect, to put it mildly. We know that in Europe as well, environmental factors play a major role with regards to the state of human health. And we have estimates that indicate that 1 in every 8 deaths in Europe can be linked to air, water, or noise pollution, as well as extreme weather events that are related to climate change. This is heavy. It's a heavy toll, particularly in the Western Balkans, which is quite striking. The percentage of deaths linked to environmental causes stands to almost 30% in Bosnia and Herzegovina and well over 20% in Albania. This is indeed striking, and we've seen it. Everybody has been reading about this, about the impact on morbidity and mortality with regards to the COVID-19 linked with localized air pollution aspects. And we all know how access to clean water is fundamental in terms of hand washing was one of the key protective action that we face. Now, you know, the aspects are not just linked with air pollution, climate change, but biodiversity loss, destruction of a natural habitat, having an important, very, very important impact on infectious diseases start, let's say, and then transmission. And you know, we know that the global socioeconomic trends and climate change together have created and will continue to impact on a world that will be increasingly confronted by fast spreading infectious diseases, outbreaks caused by bacteria, mainly viruses, etc. So, you know, as we are approaching the limit unfortunately, an increasing number of our planetary boundaries, we need to have healthcare systems that are ready and able to face these challenges. And indeed, there are a number of solutions that are emerging, and we will explore them today with our speakers. We know that primary healthcare in particular are key actors in delivering health responses to climate change. And there are a number of responses, both in terms of climate change mitigation, in the way in which we build, in the way in which we provide our services, in terms of adaptation to climate change of healthcare systems to make them more resilient. But we also have to really think of, you know, how can we better mainstream both climate-related environmental consideration in our healthcare system and how we conceive and operate them. But then also, could we then think maybe of mainstreaming health consideration across all of our investment? And how is a better understanding of the nexus between human health and well-being, climate change, and the environment in general helping? How can this help us in designing better solution for tomorrow? So I'm going to stop here because really it's about the speakers. I took a bit more time because we have one fewer speaker today, and I really would like to thank all of the speakers today for making the time, and I look forward to this discussion. So thank you very much.
Thank you very much, Monica, for setting the stage for our discussion. As you said, yes, unfortunately, we have 4 instead of 5 speakers. Unfortunately, Dr. Guerra is ill, and I do apologize on his behalf. Now I would like us to, turn attention to our panelists and start our roundtable discussion. And let's begin with Caroline. Caroline Costongs, you're a director of EuroHealthNet. This is a non-profit association of bodies working to promote public health, disease prevention, and health equality. So let's start with a kind of a double question, so to speak. What is the link between our individual choices on the one hand and health and environment on the other, but also where do social determinants of health come in this health and climate change conundrum?
Thanks a lot, Julita. It's all very interrelated indeed. So thanks for the question, and also thank you for inviting me to this important webinar. I think it's a great sign that the Council of Europe Development Bank is interested and working on this theme on climate change and health. And I liked also that Monica was mentioning that you're working on this report for resilient health systems towards climate change too, because I think that banks in general have a great responsibility to take here in what areas they invest in. And I think they play a very big role in achieving the change that we would like to see. Because the urgency indeed is very clear, as Monica has set out. We see it all around us on the news and so on. We are not living sustainably, and we are not living within the limits of our planet. If everyone in the world would live a European lifestyle, we would need the natural resources of 2 planet Earths. And everyone would have an American lifestyle, it would be even the resources of 4 planet Earths. So we do need to make different choices in our lives, and we have to do things differently from now on, in particular when we are all emerging out of the crisis. Scientists, they say that by the year 2050, we have to see a reduction of our material footprint for 45 or 73%, which is huge if we want to remain within the Paris Agreement. You know, this is enormous change that we are facing and that we need to respond to, and we cannot just continue consuming and producing the way that we are doing now. It damages the environment and it damages the health at the same time. And I will give a few examples regarding health. Well, an obvious one is food and our overconsumption. I would like to add also not only the climate, but the biodiversity. The loss of biodiversity is as bad as the climate change. That is an impact of our food consumption. This leads to obesity trends. About 30% of the diets that we consume in Europe is of ultra-processed foods, which we know is highly addictive, which we know is zero nutrients. And mainly also of that reason, about 60% of Europeans live with obesity or are overweight. Monica mentioned children. 1 out of 8 children are obese, and I find that unacceptable and really urgent to address. Also, the meat consumption is an important issue to tackle. It has increased. It gives a huge impact on the CO2 emissions, but also increase the risk of colon cancer, for example. So this is not very healthy either. And what we want is people to move more, be more active. We want to get them out of their cars, on their bikes and walking, which is much better for health and well-being. And Monica already mentioned air pollution, that indeed in Europe, it kills 400,000 people prematurely every year, which is a lot also compared to what we hear from COVID figures. So your question about our choices in life indeed influences health and environment at the same time. But in this process, it's important to realize that not everyone has the same choices or has the luxury even to choose. There are many people that are more deprived or more poorer, and they live in areas that have less green spaces, more air pollution, more traffic. They live in badly insulated houses. So these are the social determinants, Julitza, that you were mentioning. So they are, let's say, locked in their day-to-day situations and do not have to choose the choice to move out or to do something differently to change. And also, they will be more prone to the negative or unintended consequences of the measures that will be taken to address climate change. Because due to these measures, they may get unemployed, lose their jobs, have less income, and suffer even more. So any initiative or investment that we want to make in health and climate and that require people to change their behaviors, we have to think of 3 things. And this is from behavior sciences. So first is we need to address motivation and habits of people, motivation. Second is the opportunities that they get. And third is the capabilities and resources that people have. But it is all doable. We see already solutions emerging. Also in the past, we can learn from legal measures such as the smoking bans in restaurants and cafes. I mean, that had drastically changed the social norms. But also recent laws of banning plastic bags in shops and so on. And in fact, you can look at the whole COVID-19 issues. I mean, that's one big experience and behavior change, no? So I think we can learn a lot what we can do to change behavior. And the European Green Deal also for the European Union is coming with many proposals, legislative proposals for a more healthier and a climate neutral future by 2050. And we see the recovery and resilience plans for investment in countries that are dedicating investments to more greener and healthier, particularly greener, low carbon projects. So to conclude, I think legislators and investors have the most important tools, I would say, at hand to make the change, the urgent change that is required in order to move away from the business as usual as we have seen in the past. So thank you. Over to you.
Thank you, Caroline. We will have ample opportunity later actually to talk about some of these solutions that, as you mentioned, are already and fortunately on the horizon. Our next speaker is Thomas Bignal from EASPD, whom I had asked earlier not to disappear, and voila, he's here. Thomas, you are a policy manager for the European Association of Service Providers for People with Disabilities. That means your organization basically is a network of 17,000 service providers from all over Europe, which means that you represent 80 million people, or a little bit more than 80 million people with disabilities all over Europe. So for our discussion today, we would like to hear your perspective from the social care sector. Basically, what do you see as main health challenges coming as an impact of the climate change, and how do you see climate change affecting them?
Thank you very much, Yelica, and sorry for disappearing for just a minute. Thanks for the invitation. It's really good to see so many colleagues from the CEB listening and joining in. So thank you for your time. And first of all, maybe what do we mean by social care? Because there are many different definitions and understandings around Europe. Simply put, it's every type of support type service to people throughout their lives based on people who have support needs. So it can be childcare all the way to or adults with disabilities, all the way to older people who develop disabilities and then have some support needs later in life. As a sector, we employ over 11 million people in Europe, and we are, I think, in my understanding, the fastest growing employer in Europe today. And the sector is primarily run by not-for-profit providers who have close relationships very often with their local authorities. In terms of how we as a sector relate to health, well, we always use the WHO starting point. Health means physical, mental, and social well-being. And the last point of social well-being is particularly important for us, of course. So the question is, do existing social care structures promote health? I think it's a very difficult question for us in some ways, in terms of promoting physical health, yes, maybe even mental health to a certain extent. Social health, social well-being, I think we can do a bit better, and I'll maybe explain why. In the sector, we primarily are organized traditionally in large segregating type settings. Care homes for the elderly, for example, is a good example of that. The approach, the way of thinking is quite medical, as a medical background, where people in these care homes, we care for them, we cure for them, we focus on their impairment to make sure they live, healthy in terms of having enough food to eat. But they care a bit less traditionally about how these people can live independent lives, how they can be active in community, how can they participate in society. And that, for us, is crucial for really being healthy, having a social being, being mentally healthy, is the ability to take decisions over their own life and to participate in society. And it's very, very difficult to do so in these large traditional segregating care home type activities. As an example, the other day, someone came to me saying they wanted to build a care home for 250 people, all in one block, all together. Well, for us, the answer is clear for that. That would not lead to a healthy lifestyle for people in those services. It's very, very difficult, if not impossible, to do so in large segregating settings. The COVID pandemic sort of reinforced this to a certain extent. We all heard about, of course, thousands and thousands of deaths in care homes. And it's not just the vulnerability or the so-called vulnerability of people that caused that. That was an effect itself. But in these types of settings, institutions, it's the structures themselves which promoted the spread of the infections. Big care homes, they also tend to isolate people. They don't really provide people with independence, with choice and control over their lives. It's very much standardized. You wake up at 8 o'clock, then you eat at 8:30, you wash at 9, and you do this activity. There's no choice and control, and therefore no health. What we need is basically to focus a bit more on the social environment around an individual, on helping them to live independently and to respond to the individual needs that people have. Therefore, we need to invest less in large institutional settings and more in helping people to stay at home, to live in their communities, and so forth. Projects which support individual needs, quality of life, social participation, and really to help people have choice and control over their lives have a much better impact on the health over people than other types of services. So as a sector, and we represent the sector, we represent also the institutions, we need to move away from these large settings towards more community-based structures. How does this relate to the environment? Well, it's clear that climate change affects people with support needs, older people, people with disabilities, children often, and other groups, homeless people, for example, much more than the general population. This is about pollution, this is about floods, fires. These people are much less flexible to be able to move around. So of course we need to tackle climate change from that perspective. Climate change also affects public budgets. How much does this, as a society, can we invest in social care when we also have to deal with the consequences of climate change? We already see a bit of a climate expenditure versus social expenditure dilemma. I know it's unpopular to say it, but it's true, it's there. If you look at the new European recovery plans, where are the priorities? Green, digital, where's social? If I'm looking at the recovery plans, it's really going missing. It's unpopular to say that, but we need to avoid this climate versus social expenditure dichotomy, and that's difficult and complex, but we need to do it. I don't think we can do one without the other. Of course, as a sector, we also contribute to climate change. You know, we employ 11 million people. We have hundreds of thousands of services. We drive thousands of cars. We have, you know, through our processes. And as a tendency, I must say, we tend to ignore our impact on the environment. We're so focused on helping people to live better lives that we say, we don't have the money, we don't have the time. That's for other people's problems. That's for the petrol industry or the other industries, not for us. And that's wrong, and that's a very wrong definition, a wrong understanding. So we need to make sure we move that, but we also need the money to be able to do that. Also, the environment, we need to make sure that we, again, increase home care and community services. And how would that impact the environment? Well, building or making more accessible, energy efficient houses. If we want people to stay in their homes, then we need to make them both more accessible, or if they grow impairments in their life, but also more energy efficiency. Social housing is a big way there, and I know you invest a lot in that. Technology can play a big role in reducing the climate change impact of our sector. Telecare, for example, to help people look after their care needs via digital equipment, rather than having people come every day to see them when it's maybe not needed. Electric cars, we have tens of thousands of cars every day all around us from the sector. Let's make them electric, let's make them a bit more environmentally friendly. And again, we need to buy local products and services better. We've just launched a study on that, and I will share it after this. But that's it for me for now. Thank you very much.
Thank you so much, Thomas. When you speak about climate versus social dichotomy, you are definitely preaching to the converted here, because of course, Council of Europe Development Bank has an exclusively social mandate. So this has indeed been one of our major messages, and advocating for a fairer post-COVID recovery. You talked a little bit about buildings and how buildings and care facilities come into this whole health versus the climate change picture, and that brings me to our next speaker, who is Stephanie Matisse. She's managing director of European Network Architecture for Health. So this is an organization which actually builds upon knowledge from architecture, but also public health and health economics to work for and advocate for more sustainable healthcare. So my question for Stephanie today is, looking at our existing health infrastructure, how much is it climate risk proof, and how consistent is it with our proclaimed aims for a decarbonized and green and circular economy? And if not, what can we do about future healthcare infrastructure?
Yes, thank you, Yelitsa. Do you hear me? Yeah.
Yes, excellent.
Okay, thank you. And thank you very much for this invitation to bring in the perspective of architecture in this discussion. And yes, I'm an architect, and architects like to speak along pictures and plans. So I brought this slide that you hopefully will see, and would like to point out a little bit the connections between healthcare infrastructure and climate change. And by the way, it links very much to that what Tom said just before me. The investment in healthcare infrastructure is very much focused on the economic success, of course, of healthcare infrastructure, and these social aspects often come far at the end of the discussion. But well, I stick to this graph for the moment, which is not mine actually, but from Climate Data Canadian Society. But it explains very, very well, I think, the direct relationship between climate change and the risk that result from climate change for healthcare infrastructure. Of course, we already talked about the rising temperatures, extreme weather events, and the level also of the rise also of the sea level, which are the direct hazards of climate change that will impact all our lives. And what does that exactly mean for healthcare infrastructure? Well, it affects healthcare infrastructure in a multiple way. On one hand, when we talk, for example, about the rise of the sea level, we have to consider construction sites. This is maybe not the focus of every country, but several European countries will have to consider where they can build their infrastructure in the future when we talk about the rise of the sea level of 40 or even more centimeter in the next decades. We talk about extreme weather events, storms, heavy rainfalls that impacts very, very directly our buildings, because we will have damages, we will have flooding, we will have interruption of supply chain, and that will mean interruption of health services, or even disruption in the energy systems of our healthcare. So hospitals and care facilities have to be prepared in that sense too. And a third point, the rising temperatures, which is maybe right now the most felt impact. We can also already fear the consequences of heat waves that we experienced in the last years in Europe. I have been in Paris during the big canicule, the heat wave, some 15 years ago. So it was not a very nice experience. And yes, we already heard it's the most vulnerable people, those who are already ill and ill with cardiovascular diseases, especially, and those with lung diseases and asthma patients. That will be affected mainly by heat waves, but also elderly and newborn and children. And so we talk here about this group of people who are living in hospitals or in care homes. By making our hospitals more resilient against these threats, we will protect these vulnerable groups, especially. And your question was already evoked this double view or double perspective on the problem, because hospitals are not just suffering from climate change, but they are also a big problem when it comes to contributing to climate change. Or not just hospitals and care homes, but the building or the building sector in general. Let's say, maybe to give some figures, in the EU, 40% of energy consumption is caused only by buildings. 36% of CO2 emissions are caused by buildings. And it's mainly the already existing, the old building stock, which is the problem, because 75% of it is not energy efficient. And measures for adaptations are advancing very, very slowly. So it's only just maybe 1% of buildings which are renovated and adapted to this new challenges of energy efficient building. So I think it's here that we have to do something. It's investment in energy efficient and building stock. It's the investment in resilience of the building stock. And yeah, maybe I stop here because we will have another round and to be a little bit more precise about that.
Thank you, Stephanie. Our next speaker is Pascal Garel, who is the Chief Executive of HOPE. This is European Federation of Hospitals and Healthcare, with members in across the European Union, but also United Kingdom, Switzerland, and Serbia. So, Pascal, you have quite a unique insight into healthcare landscapes across Europe. So, perhaps you can share with us whether you see any differences in the perception of this, health, the climate change nexus among the different countries with which you work, and if that is the case, why and how you would explain that.
Thanks a lot, Yelitsa. It's a real pleasure to be with you today. I would like, first of all, before answering your question, to congratulate the Council of Europe Development Bank. It's very nice to work with the Council of Europe. As you mentioned, we are very EU-centric, and even in our constitution, the voting right is only for members from EU countries. But we have been working a lot with the Council of Europe in the past years. Unfortunately, you've reduced, not in the bank, but you have reduced your activities in health for financial reasons, I understand. Yesterday, anyway, I was working with Council of Europe colleagues on pharmaceuticals, which is still a big topic. So thanks a lot. Congratulations for organizing this. The other banks didn't do it, so I have not received an invitation from the European Investment Bank nor the EBRD. So congratulations to you all. Thanks also for mentioning our diversity, and we are a good mirror of the European Union. Originally in 1966, when we were created, we were hospital-centric, like, let's say, most of the European countries, including the Central and Eastern Europe at that time. We have moved because of membership, because of enlargement. So now some of our members covers hospitals only, some covers hospitals and primary care as well, and other sectors, and even some covers the social sector, which is very important because the integration between the different levels do not work. So it's good that internally in the organization, some of our members could show good practices of this happening. To come back to your question, perception, objective elements. What is interesting now, since we have this big recovery plan in the EU and in other countries, it's that the OECD, I know that your members are not all in the OECD, but the OECD is working on this database of green recovery. So that's a very good element. We need to get clear objective elements about what is going to be done with those recovery money. Thomas mentioned these recovery plans for all EU member states. I have not had time to read all of them, but it's clearly where we have to put our nose into, because there should be green, there should be health, and there should be social things. So for the objective elements, I hope we get a good idea about what is going on. The perception of the healthcare sector is changing. Compared to, let's say, I started 30 years ago in the health management sector in French hospitals. And just give you an anecdote, in the press, the regional press at that time, I was in the west part of France, had this picture of a syringe in a landfill, open landfill waste, thing. And that was the situation at that time. And the press was everywhere mentioning the dioxin that the hospitals were disseminating in the environment because we have those burning elements. So that's
Je suis assez étonné de l'accent des gens en fait. On ne sait pas trop s'ils sont français ou s'ils sont.
Antoine, je crois que tu dois te muter, Antoine.
So
I think it's done. Sorry, Pascal.
No, thanks for contributing to this. So the things are changing now, but again, at a very different pace from one country to the other. What is important to understand is also that we're affected by many different logics in the healthcare sector for the last years. One is safety. Patient safety, professional safety, which has changed the way we organize the waste management, which means that we have developed a lot of single use. And a good example is the mask nowadays. But look, guys, it's not new. We have been producing huge single-use material. Don't forget that those who are responsible of single use, of saying what is single use, are the industry. And so we are also fighting the fact that the industry is creating more so-called single use that could be reprocessed, actually. So that's another debate, but that's an important element. I will come back to that later. So we have this issue of safety. We have the issue of the environment. Climate change is, for me, and Monica was clear on that, is only one part of the environment issues. And Caroline mentioned air pollution, water pollution. They are very important. And sometimes the climate policy we see developed are not very good for the environment, or even very bad for the environment. So that's another additional tension. So we have to take care of the environment. And then, of course, the elephant in the room is financials. We get more and more pressure. Why? Because we have been stigmatized even more after the economic and financial crisis. We have been stigmatized because we are using public money. We have been the culprits of the failure of the banking system and financial system. So a lot of our members have been, forced to cut costs. And where do you cut costs? You cut costs where you can. And for example, in sectors where it's not visible impact immediately, environment, investment in green buildings, and so on. So that's the topic. And if you put that in context of a national level and even regional level, because in Europe, a lot of decisions are taken at regional level, then you get a lot of mix. So there are initiatives in some countries. Some of our members, since you are in France, the French Hospital Federation has these 50 different ideas around how to spend more wisely for the environment, those big 100 billion euros that France will get. Others in Germany have created networks of hospitals and so on. So there are plenty of solutions. We can come back later, but you understand the picture is quite diverse, also depending on the development of the systems, on the age of buildings, which was mentioned by Stephanie. And we cannot get rid of all of them in one day and put a nice new green building. So what do we do with that is the question in many countries. And again, the recovery will not be enough. So we need you guys to help us to fulfill the goals that are put to us, not only the climate goals, but also the environment goals.
Thank you, Pascal. Just to go back to the point that you made earlier, although we are obviously eternally indebted to the Council of Europe, who are part of our origin story, we are a separate institution, and investing in health is very much our priority. So I just wanted to reassure you on that. I think we got a pretty good lay of the land when it comes to the challenges of health and climate change. in our first round of questions. So now in the second round, we're obviously going to be looking a little bit into potential solutions. And I think all of us need a little bit of reassurance that this is not all doom and gloom, even though at times it really looks a little bit like it. At this point, I would also just like to remind the participants that you can also put your questions in the chat box, and we will have time to address them after this round. So to go back to you, Caroline, because that is where we started. So maybe now is the time to talk about those preventative health measures and how they can help us in this interplay between health and climate change.
Thanks, Jelica. Indeed, EuroHealthNet, we are linking via partnership of national public health institutes and regional health authorities, and very much work on prevention and public health. Even though we see there are great examples in the hospital sector about greening hospitals and also creating healing environments, bringing nature into the hospitals. But I'm sure, and I hope that Pascal will talk more about these in his talk later. So I'll stick to the health promotion and disease prevention, because this is really important. You can make very nice links with the environment sector and with the social sector. And there is lots that can be done. And I will give sort of three examples in three areas. So the first area of food. What we need to do is to change the diets of about, 700, 800 millions of Europeans to more plant-based diets. We have to steer them away from these ultra processed food, and particularly also regarding children, we have to reduce the marketing of food towards these children, and make sure that they adopt more plant-based diets. It's not so easy, of course, and how can we do this best? Well, there are various measures here, like reducing the marketing, but also food labeling, so front of package labels for health and sustainability, but also with taxation, lots can be done. So taxation of ultra-processed food, or providing subsidies for fruit and vegetables, which is particularly important if we want to reach the whole social gradient and all people. Also providing really nutritious and healthy foods in schools, in canteens, and so on. But there will always be quite a bit of resistance of people to give up their daily meat. So we can think more creatively. What can we do? So we can invest in startups or in companies that make meat in labs, for example. In the Netherlands, they produced a hamburger from the lab several years ago. It's called Mosa Meat, and they use the stem cells from cows, from the muscles of cows, and they produce the meat in labs. This meat is supposedly to taste healthy. I haven't tasted before, but it is supposedly tastes good. It is healthy. It's definitely not killing animals, and it will have a huge impact on biodiversity and on climate change if many more people would switch to meat based coming from lab, or obviously also meat substitutes. A second area is transport. It is public transport is the way forward, and in particular public transport using hydrogen as fuel, because hydrogen is the cleanest of all energies, of all fuels. It is in particular for public transport, buses and so on, and it will reduce air pollution drastically. It's in particular good for health if we link this with active travel. We like cycling and walking. We have done some research in Prague, where they developed a very nice app linked with bike rental services that was sort of picked up by a few people, and then more and more people used it. Then the municipality, they saw that and they responded by improving the cycling infrastructure that attracted more people to take the bike and commute to work. It attracted bike repair shops and other shops, and really created a positive feedback loop. And this is what we would like to see. And I think that banks and impact investors really have the opportunity to add to this regenerating action and this positive feedback loop. A third area is in nature-based solutions. We, in particular in inner city areas or more deprived communities, we want to see more green spaces, parks. There are ideas like forests, tiny forests, pocket parks, but also food gardens linked to schools, for example. And here again, a nice project that we were involved in Rotterdam, where they, in a deprived area and a harbor area, where they transformed a wasteland into a food garden. And they invited volunteers and unemployed people, and they trained them, and it was linked to a restaurant where they get further training. It was linked to education with children and school. So it's really a very nice project, how the social and the climate and health and well-being comes together. And I think it is these kind of community projects, grassroots initiatives that we need to support. We need to give them some seed money. We need to take away barriers that may exist, legal barriers, political barriers, and try to really get that mobilization from the ground. Because if we want to see change, they say, and it is true, I think it first comes from the people, then from the investors and the businesses, and maybe only later from governments. So indeed, I want to again stress that the Council of Europe Development Bank and all banks, in fact, have the responsibility and the power also to invest in sustainable and healthy and in social projects, and maybe also to disinvest in those projects or products that are not so sustainable if we really want to accelerate change. I think there is a momentum, a great momentum, and we cannot deny or avoid the climate crisis. It is indeed, from the point of health, it is looking at climate adaptation, but I find climate mitigation so important. And I'm really happy if you are going to take this forward, and EuroHealthNet is very keen to, I guess, with many more here on the panel, to support and provide input, maybe in your report, as Monica was setting out at the very start. So yeah, looking forward to the next steps. Thank you.
Thank you, Caroline. So it is good to know that there are measures that work and that we can change our bad habits and have a positive environmental and health impact. This is definitely good news, except for those of us who don't like veggies. But moving on, let's look at social care and how can actually social care protect those who are most vulnerable from the negative impacts of climate change. Thomas.
Thank you, Lisa. Interesting question, but if I may say, it's from our perspective the wrong question. For us, it's not so much about protecting the most vulnerable populations. We think that way of thinking is a bit outdated. For us, it's much more about how can we empower all people in society, be active citizens and healthy in times of climate change. So rather than focusing on protecting people, separating, segregating from maybe the realities, it's about empowering these people to live active lives whilst also taking into account, let's say, the realities that we experience in terms of climate change. In terms of the details on climate change on people's health, I think Caroline answered that far more better than I could. Of course, this is about a question of public health, which fits all people. In terms of our sector and how we see it, first and most, the people that we try and support, they still have to have choice and control of their lives. I don't think it's us as professional social care providers to take decisions for them, even in terms of the climate. People who are not supported by care professionals, they choose if they want to be vegetarian or not most of the time, and we shouldn't take that away from people just because they receive professional support from others. What we can do as a society and as professionals is inform these people about climate change, inform these people about the consequences that it may have over their health, and then these people take decisions for themselves. And that includes issues like plant-based diets, etc. So involving them in the process is important. Again, for us, protecting health is about developing home and community services, moving away from institutional forms of care. But we need the money to be able to do that. And we talked about a bit the disinvestment in health over the last 10 years. Well, this has been even more strongly in social care, especially with the rise in demand. We've had very, very little money coming into the sector. So then talking about how to support our sector to shift towards more climate-friendly types of provision, well, we need more investment for that. We need more investment, generally speaking, but also for climate change. And we need initiatives by public authorities to be able to support us in that. I think from a sectoral perspective, where we're mostly not-for-profit oriented, local associations, cooperatives, foundations, it's in our nature to think about general interest and therefore to think about climate change. But at the same time, it's, our core responsibility is to support people. And therefore we need to be able to have a frank discussion with public authorities over how they can support us in making this climate change. We are interested in doing so, but really we need support also to make this happen. And disinvesting like we've done over the last decade or more is really creating lots of challenges there and is hindering our response to it. And maybe one last point for our perspective is, whatever the measures that are taken to mitigate climate change, if it's in hospitals and by society as a whole, by social service providers, we really need to, let's say, co-produce the solutions, co-create the solutions together with individuals who are maybe suffering from it most. So us as service providers, if we are going to shift the way we provide our services to make them more climate friendly, we have to involve and consult the individuals that we support or representative organizations. We can't take these decisions without them. And that's sort of how we see the best way to empower people, because you can't empower people without protecting them, but empowering goes a step further. You can't do so without consulting people on their needs and how they wish to move forward. So it's information, it's consultation, that's the way forward. Thank you.
Thank you, Thomas. That's a point well taken on protecting vulnerable populations. That really does sound a little bit patronizing, when in fact what is meant that we are striving not to leave anyone behind. So inclusion, in fact, inclusivity is really key to what we're trying to achieve here. Let's move to Stephanie. The big question for you, Stephanie, is how can we make our health infrastructure, well, first of all, more climate resilient, and also, decrease the detrimental effect that it might have on the environment. So that it's a big question and a big responsibility as well. So what are some of the solutions?
Yes, thank you. And I prepared yet another slide. I don't know if you have it.
I believe that Maria should have it if she's still there.
Just to illustrate a little bit in which ways or the possibilities we have to change our healthcare infrastructure. And this points out some solutions. We can make our hospitals and social care buildings more resilient by looking at the facade, for example. We can have higher insulating facades. We can use external shadings. We should offer cross ventilation, and we should maybe even consider greenery in the facades for shading. We should also look at the surroundings of infrastructure, because it's very, very important to have green and unsealed surroundings to enable reduction of temperature and evaporation. We should also offer shaded areas outside, and also have to think about which kind of plants we can use in the future, which are resilient to climate change and temperature rise. We have to actively use roofs by transforming them into green spaces, and also by using them for solar panels and photovoltaic panels in order to change the energy consumption of the buildings, in order to switch over to renewable energy. And of course, a very big impact in healthcare infrastructure is the building technology. So we have to use heat recovery systems and adiabatic exhaust air cooling systems to have a better efficiency. And we can even go inside the building and look at what can be done inside. Even by choosing light colors, we can profit from the reflection and reduce indoor temperature, for example. Or we should consider proposing cooling centers in healthcare facilities for the most vulnerable groups. Using thermal activation of the building structure, for example. So this gives an overview of the possibilities that we have that can also be adapted to already existing buildings. But what I would like to point out too is to go a little bit away from the focus on just architecture and the building, and to emphasize the idea that we have to consider very much more our entire urban habitat. And we have talked a lot, or Caroline talked about it, and also Thomas right now talked about empowering people and in changing lifestyles. And our life is more and more life in cities. So urban planning is a very, very important factor when it comes to creating these healthy lifestyles. And we know a lot about how urban settings influence health. There have been WHO programs running since the 80s. So the healthy city is not a new idea. We know about it, there's a lot of research about it, but it is not implemented, not enough. We have had discussions about green, about blue cities, about I don't know what cities, but the healthy city is still not a reality. And this is why I think, or what would be my wish for the future, is that all urban developments should be subject to health impact assessments. And that is not the case right now. So health could be the guiding principle of urban plannings in the future. That would be my vision. And coming back to the question of how to invest. So maybe the barrier, or the main barrier why these healthy city ideas or urban planning ideas are not yet implemented is because we didn't discuss the business case of the healthy city. Who are the winners? Who are the losers when we talk about healthy urban planning? Who is the one who has an interest to invest? It's not the private sector, so they will have to have some incentives when they want to, or when they should invest in healthy infrastructure. So this is maybe the discussion we have to lead. Thank you.
Actually, Stephanie, I have a follow-up question, and it is about the ability of health infrastructure to withstand future pandemics, which we know now that unfortunately, thanks to climate change, we will probably have to contend with for some time. And I know, having read also on your website about some very interesting interviews where ideas were put forward about how our current hospital design impedes effective dealing with pandemics, especially when it comes to infectious diseases, where it's very difficult to separate patients, and the whole multi-bed per one room is not exactly conducive to like a proper hygiene, etc. So I mean, do you, as an architect, now speaking really as an architect, do you see almost like we talk about revolution in office design post-COVID, but do you see something like that when it comes to hospital design? kind of as you know, putting in action some lessons learned from this pandemic?
Well, in that sense, I would say there are several aspects which can be looked at. It's you already mentioned it, separation of infectious patients and others. But maybe more generally speaking, I would say to make hospital infrastructure more flexible for the future would be the point which I would emphasize, because we saw in the beginning of the pandemic, we had to adapt our infrastructure very, very quickly to this to these cases, and that leads to the conclusion that we need very flexible structures. We have to have rooms which can adapt it to normal care, but also to intensive care very quickly. We have to maybe think more about kind of a modular architecture which can adapt very, very quickly to different cases. So this is one point. And also I think that we have to, in order to be more flexible, we should also consider that we need a little bit more space than that what we have right now. So right now, programs for hospitals are designed to be optimized for a very specific case. If we want to be more flexible, we have to maybe plan for a little bit more space which is not yet needed maybe, but should be attributed then in future. So these are maybe the 2 points I would highlight in this sense.
Thank you, Stephanie, for this insight. And this is something for us also to keep in mind as obviously a financier of health infrastructure, among others. Our last question is for Pascal Garel. You have launched a review of good practices in hospitals and healthcare, and you started publishing them very recently on a weekly basis. So I am sure that you have plenty of interesting examples to share with us about the solutions to the health and climate change conundrum coming from your own membership.
Yeah, yes, a lot. Thanks a lot. We are not the only one to do this. As I said, there are networks at national level. There is also a very nice network called Healthcare Without Harm, which is a global with a European component doing this as well. It's also a way for us to, push our members also to be able to identify what they are doing, share also at national level if they don't, and share between countries. And then, of course, there are plenty of examples. A lot could be said also about other things that should be done and will be done, hopefully, at top level, which means, for example, very few of our hospitals are producing their own energy. They are buying it. And of course, if the country is moving to a green energy, it's better. But even in that case, we did actually in 2009 a survey to identify hospitals producing their own energies or co-generation of energy using alternative energies. And we already found quite good examples around that. So that's one point. But then the things we're doing now is more a bottom up. We want to get feedback from individual hospitals, what they are doing, what they think they are doing good in that sense. And it goes from topics that already were covered, for example, by Caroline, food. I mean, the last hospitals I was in Rouen and Normandy, we were producing 3 million meals a year. And so it's like, well, we had 2,000 beds. So imagine the millions of meals produced. So if we do the limited things that Caroline mentioned, it's a huge change. And Dutch hospitals actually have been also very motivated on that. So there are plenty of examples, and we'll come back to this in our weekly examples. Food waste as well is an issue. Of course, everybody complains about the food in hospitals. Let's be clear. And the French are the best for complaining about that for very different reasons. Also because we have industrialized it, because it's reheated and so on. There are plenty of reasons. So there is a lot of waste, and that's something also hospitals are tackling, finding alternatives and so on to so that this food is not completely wasted. That's an example. Transport was mentioned. I mean, and urban planning. If you build a hospital or renovate a hospital or reorganize your transport, please have a stop in the hospitals. You know, that sounds crazy, but I see some hospitals where the line stopped a few meters before the hospitals without access for people with disabilities and so on. So, you know, we are part of this, and it's important. We are also ourselves owners, in some countries, owners of ambulances, and some counties in Sweden, for example, have been developing their fleet of cars, of ambulances with electric cars quite early, several years ago, and others are following on that. Water is also an issue. Our nice colleagues on pharma industry are trying to put the blame on us, hospitals, for polluting the water. Well, actually, it's the consumption of drugs from us in the community that is the most important issue. But hospitals can do something also on their side, because yes, of course, the water going out of hospitals is also polluted by pharmaceuticals. And again, some hospitals have been taking this challenge and have increased the quality of the water they put in the sewage of the system. I mentioned reprocessing, and again, coming back to this simple thing of a mask, a protection mask. There are companies now that are able to reprocess those single-use masks, and that's where the effort should be put, maybe more than on trying to repollute Europe by reindustrializing our countries, like our dear friends in France would like to do, which maybe is just a dream, but there are other solutions than trying to do the bad things we were doing before. So again, a lot of good examples to be found. Bottom up, it's always important to get the feedback, and I will finish on a very nice also bottom-up initiatives from the French Society of Anesthesiology and Resuscitation, and together with their European colleagues, they clearly said something that is not so much known, that actually in the hospital, more or less 30 to 40% of the waste of the energy spent and also of equipment purchase is operating theaters. And a lot could be done there. Just not having those operating theater 24 hours energy, even if they are not working, and so on. So there are plenty of initiatives coming from the bottom that will be taken individually by hospitals. But what will be significant is that at the top, in particular for climate, the energy is greener, and that also investment is made at national and regional level from those who have the money to help us to be more vigilant in this issue.
Thank you, Pascal. So clearly solutions exist, but as you said, currently more bottom up, and there will be additional effort needed and definitely investment to scale this up. On that, we actually have a question from one of our colleagues who says, you know, how can we make sure that this transition to new lifestyles and urban environments is socially inclusive, right? She says environmentally sustainable food or living environments tend to be less affordable and can push disadvantaged families into hardship. So what can be done about that? I think Caroline, perhaps that's mostly the question for you. You get the tough ones.
Yes, it's a difficult one. But I looked up some figures on this one just to set out the problem. That indeed, if a family would want to stick to healthy eating guidelines, then and then there's a poor family, then they would spend 74% from their income on food, while for the highest socioeconomic people, they would only spend 8% of their income on food. And these are figures that comes from Professor Michael Marmot, who is a key professor in health inequalities. So he was stating clearly the reason that they eat healthily is not that they are lazy or they don't like it, it's just because of poverty. And this is clearly important and we need to address, and I already mentioned taxation of bad stuff and subsidizing the good, the healthy products. But you can also think of, and there are examples of co-ops, like cooperatives, food co-ops, of supermarkets that are being owned by the citizens, and then they volunteer, they work themselves there. And so there are examples, innovative examples out there that that also link nicely to more community cohesion, to social work, to health, to, you know, if you also involve local farmers and have short lines between the co-op and local farmers, you know, it also benefits the farmers and nature. So there are great examples out there. It's just, and it was said before, that these are not enough. They are not yet of enough high scale or enough in number to really make a difference. And there is, I think, where we can make a difference by supporting these initiatives more, by highlighting them more, and see there are alternative ways of dealing with society than the current ways, which is very much focused on economic gain.
Thank you, Caroline. We don't have any more questions at the moment. There was a little exchange in the chat earlier, but and thank you to those of our speakers who actually responded to participants and provided some useful resources. So unless there are questions, I would actually like to invite my colleague Toma Kergal, who is the technical advisor for health and social care, to wrap up this session. Actually, now that I said that, I see that we have another comment, so I will read it. It is from our colleague Samir, who says that evidence-based design approach adds value to design of hospitals and recovery of patients. Any interesting evidence outcomes from the pandemic that will become inputs for building codes for design of hospitals? That sounds like a question for Stephanie and perhaps Pascal. Stephanie, would you like to respond to this one?
Yes, I understand the question as, will there be inputs from or lessons learned from the pandemic, which will be transformed into building code? Well, I think it's too early to discuss that, or up to my knowledge, we are not yet in that stage of transforming the lessons learned into new regulations, but surely there's huge discussions about it, and of course that will come, I guess. As for evidence design approaches, we discuss that a lot, and I see steps forward in this sense too, because these topics of how architecture and urbanism affects health is very much discussed in the last decade, we can say, and I see or I feel open ears and open eyes in the healthcare sector for this matter. So for example, we were able to make a consultation for Charité, a university hospital here in Berlin, who are very interested in learning about evidence-based design approaches. So they want to include this knowledge about how architecture impacts health in their new building design. So it's quite good sign, in my opinion. Yes.
Yes, we also have a comment from our colleague Isabel. I will read it. It says, construction companies and architects are coming up with more cost-effective ways of building energy-efficient buildings, and also more mindful ways in terms of safety and protection of workers. So hopefully from that point of view, we're heading towards more affordable quality housing, even unsubsidized. And I suppose by housing, we really just mean, infrastructure in general as well. Yes, there is preliminary evidence on design approach for ICUs, not officially published as yet. Right. So Stephanie, really, it looks like, building infrastructure design is quite a hot topic at the moment. But if we don't have any more questions, then I would like to ask Thomas to wrap up this very, very interesting discussion before we close the event. Thomas.
Thank you, Yelica. Thank you to all of you for a very stimulating discussion. I will try to wrap up, and I would say that basically we've heard about the potential impact of climate change and environment degradation on the health and other related systems in our societies. The four of our speakers have recalled what we've seen in many reports so far, that if unchecked, climate change may cause 250,000 deaths per year between 2030 and 2050 by the combined effect of loss of biodiversity, poor nutrition, water sources becoming inaccessible, and soil degradation. We've heard from you about the direct and indirect effect on health and social care services delivery that have underlined the issue of, for instance, non-communicable disease, which was already challenging the future of our healthcare systems until now. With the convergence of progressive societal aging, innovating and expensive treatments for lifelong chronic conditions, which are creating indeed further disparities in our unequal societies, dementia and mental health degradation, requiring long-term social care and palliative medical treatments. In fact, Caroline, you said that we need to change our lifestyles. And to that end, we need to address motivation, learn from legal measures that were taken in the past. You gave very interesting examples about measures that could help improve both health and the environment, in particular in the food industry, by, for instance, investing in innovative startups that would allow to have a huge impact on the environment, investing in public transport, for instance, using hydrogen, and building more green parks. In fact, you encouraged us, the bank, to invest on climate mitigation projects, and this is really on top of our agenda, as you may already know. Thomas, you actually pointed out the difficulties on healthy lifestyles in social care homes. You really stress on the necessity to improve social environment and autonomy for those residents. But you said that they're impacted by climate change as well. And the main issue for the sector is to avoid having to choose between improving social care services and climate change. You were very straight in saying that the real question is to empower people to live active lives and make their own decisions and choices. You were also pointing out that in the past 10 years, we have seen less and less money in the health and social care sectors, and there is really a need for more investment, and that was really a clear encouragement for us. We need to take up on your advice to create solutions together. And in fact, this is what we are trying to do whenever we appraise projects in the health and social care sector. Stephanie, you made it clear that there is indeed a direct connection between health and infrastructure, health infrastructure, and health. And you reminded us about the most vulnerable people are affected by climate events, especially in care homes and hospitals. And we all suffer from it, but contribute to it. Investing in more energy efficient and resilient buildings is really what needs to be done, and you offered some very nice practical solutions. Obviously now I know what to put as a recommendation in my appraisal reports, and my country managers colleagues will not be surprised to read my conclusions. But basically, you also said that it's important to look at the local environment of the health facilities that we will be financing, and probably to give a better focus on urban planning that should be maybe subject to health impact assessment. You also stress the flexibility that is needed in our construction projects, and this is something that we try to put forward each time we appraise a project, and the necessity for more space, which is a little bit in contradiction with the conclusions of some city planners. In fact, in Paris, they are telling us that we need to build higher to take less space and have more density of people. Pascal, you actually stressed the progress is made already in the past 30 years, but you of course underline the fact that much more is needed in terms of safety, the necessity also to better tackle the environment and climate change together, and the financial constraints that the sector has, financial constraints that prevents better quality investments. You stressed the many opportunities inside the daily operations of hospitals, opportunities to include the climate change impact, including in the production of meals, the use of water, and the treatment of waste. So if we go back to today's crisis, the pandemic, we see that, of course, there is much progress in vaccination, and this is probably the way out, but we need to be very careful. We can only hope that those lessons will not be forgotten, and that the resilience plans that are being put in place need to address the key changes we need to include in our agenda for the future. I'd like to finish with one example that was actually shared with me this morning. 2 weeks after the first lockdown in Italy, the Venice Lagoon was clear as never before in 5 centuries. So I'll end on that, but I'd like to mention, before giving you back the floor, Yelica, I'd like to mention that CEB is a founding member of the Decide Hub network alongside Hope. And this is why they are co-organizers of this event. Decide is a global network for value for money in health hosted by WHO. And the purpose of the network is to help decision makers in health achieve best value for money in health choices and policies through data analytics and knowledge. And this fits very well the challenges that we have in front of us. Thank you to you all.
Thank you, Thomas, so much for this excellent wrap up. We are very close to the end of the event. So just to tell you that we are going to launch a very, very brief poll as an opportunity for you to give us your feedback. So, do take a minute just to tell us what you thought about this webinar. Thank you, obviously, so much for attending today. And if you are interested in future events or publications from the Council of Europe Development Bank, then please do not hesitate to sign up for our email updates. And of course, follow us and all of the other participating organizations today on social media. I would also like to thank Schumann Associates, who helped us with the logistics of this event. And of course, a big and very, very big thank you to our speakers for a wonderful conversation today. It is very clear that not only do we have to build back better, but also build back fairer. And we are very much looking forward to working with you when and where that is possible to make that happen. So thank you very much to all of you today, and have a very nice afternoon.
Thank you. Bye-bye.
Thank you.
Thanks a lot, Thomas and Yelica.
Bye. Thank you.
Thank you. Bye-bye. Bye.
Much.
Bye-bye.
Thank you. Bye-bye.